When a rigid plant hair pierces the human skin barrier, it injects an irritant that immediately triggers localized swelling and redness. This is the primary defense mechanism of Urtica urens, a member of the Urticaceae family, commonly known as the small stinging nettle. Found throughout Europe and other temperate regions, the plant is easily identified by the acute physiological reaction it provokes. Direct contact with its leaves and stems causes the stinging hairs to break off and release their contents, resulting in intense, localized burning and a sharp itching sensation. In the practice of pathogenic profiling, a substance's toxicological effects map directly to its therapeutic indications. The specific biological trauma a plant induces points exactly to the clinical pathology it can treat. The localized trauma caused by the raw plant establishes the template for its broader clinical application. The clinical action of Urtica urens operates across three primary spheres: the skin, the blood, and the urinary organs. We will analyze this remedy chronologically, starting with the immediate surface irritations before tracking its deeper systemic responses. Utilizing this profile requires precise observation of the patient's environment. The practitioner must record the specific physical and thermal triggers that provoke the pathology, not just the resulting symptoms. Urtica urens is highly specific. It is not indicated for general rashes, but strictly for dermal eruptions that perfectly mirror the plant's own toxicological signature. Treatment efficacy depends entirely on this dual alignment. Both the symptom presentation and the environmental triggers must match the plant's profile. By isolating these specific variables, we can construct a unified clinical model of Urtica urens, mapping its application from localized skin irritation to deep systemic alternation. The primary clinical presentation for this remedy is urticaria, presenting as elevated, inflamed welts forming rapidly on the skin surface. For Urtica urens to be indicated, these hives must present with a specific triad of sensations: intense burning, continuous itching, and sharp stinging. The onset of this pathology is highly volatile. The eruptions do not build gradually, they appear suddenly and resolve just as abruptly. The clinical data identifies precise dietary and physical triggers for these hives, most notably allergic reactions to ingesting shellfish or fish, or eruptions that emerge immediately after bathing. This acute dermal reactivity also extends to direct thermal trauma. The remedy is utilized for localized heat damage, proving highly effective for first-degree burns, scalds from hot liquids, and severe sunburns. It also maintains a secondary dermal application to alleviate the intense itching that typically occurs during the late healing stages of those burn wounds. The dermal sphere of Urtica urens is governed entirely by acute, superficial heat and sudden volatility. Tracking the pathology deeper, we encounter a critical differential keynote: symptom alternation. Hives and rheumatic joint pain act as opposing physiological variables. When skin eruptions disappear, severe pain instantly manifests in joints. If joint inflammation subsides, the rash aggressively returns. These rheumatic pains are strictly bound to this alternating cycle, distinct from standard mechanical wear. This shift suggests pathology traveling through metabolic clearing pathways. The remedy facilitates elimination of uric acid, preventing it from depositing in the joints. The remedy's systemic action also controls deeper excretory and secretory functions, beginning with the urinary system. The general urinary presentation includes an increased frequency of urination, which is characteristically accompanied by a burning sensation. Clinically, this translates to a specific pediatric application, providing targeted treatment for nocturnal enuresis, or bedwetting in children. Shifting to another primary secretory function, the remedy exhibits a regulating influence on the female reproductive system, specifically regarding lactation. It acts as an effective galactagogue, indicated to promote and increase milk flow in nursing women when it becomes deficient. However, this indication requires a precise environmental trigger. The remedy is deployed when lactation suddenly stops following physical exposure to cold. Both the burning urinary excretions and the sudden cessation of milk map perfectly back to the overarching profile of acute irritation and rapid onset. Urtica urens acts deeply to regulate critical bodily fluids, reversing sudden biological suppressions and stabilizing erratic excretory functions across the body. Every clinical prescription must be validated by its modalities, the strict environmental conditions that dictate when the patient's pathology worsens or improves. Urtica urens is governed by a rigid thermal scale. Physical aggravation is immediate. The patient's burning and itching sensations are demonstrably worsened by tactile touch and physical exercise. Thermally, the pathology deteriorates under heat. Generalized warmth, and particularly exposure to a warm bath, will severely exacerbate the symptoms. Relief is achieved exclusively at the opposite end of the spectrum. The patient only improves through cold applications and direct exposure to open air. These thermal rules reflect the initial botanical pathogenesis. A plant that induces a burning, inflammatory trauma logically requires a cold intervention for relief. Matching the physical symptoms alone is insufficient. The clinical prescription of Urtica urens is confirmed only if these strict thermal rules are also present. Looking at the signalized list of therapeutic applications in the Materia Medica, every clinical use traces directly back to the model we have constructed. The application for allergic skin eruptions and urticaria stems directly from the sudden onset, heat-aggravated dermal keynote. Its efficacy for burns and scalds relies on the direct pathogenic mapping of localized thermal trauma. The indications for rheumatism alternating with urticaria are built entirely upon the systemic alternation phenomenon. The treatment of gout requires the remedy's capacity to reduce uric acid, linking the joint pain back to the urinary clearing pathways. And the treatment for lactation disorders remains tightly bound to the precise modality of physiological suppression by cold. This forms a unified clinical profile, defined by burning diurnal reactions, alternating systemic inflammation, and a strict intolerance to heat. Urtica urens functions as a profound clinical tool, provided the practitioner understands the precise mechanical and thermal laws governing its pathogenesis.